Among the many groups of people hurting from effects of the pandemic are veterans, as outlined by a new report about their needs. These are people of different generations with different challenges, ranging from concerns about healthcare to housing, education, or even childcare. The report was commissioned by the veteran network community Brighton Marine. To tell us about the report are the agency's president and CEO, Michael Dwyer, and one of its directors, a former Veterans Policy Director for the White House, Rosye Cloud. I'd like to thank you both very much for being with us.
Thank you,
Thanks for
Chris.
having us.
I want to start with Rosy because when people hear the word veterans, they think of one or two things. Maybe all these older guys in white shirts with salutes going on, or maybe the homeless veteran in the street. But in between, you've got a whole lot of other people. Tell us about those other people.
Thank you, Chris. I mean, veterans are not a monolith, and I agree with you. I think sometimes we think of them by era versus as a community, and to understand the veteran population, I think it's really important to know that while we have a lot of conscription era veterans that certainly are using federal services and have needs, we also have a lot of veterans, military families, and caregivers that are young, that are in the workforce, that are vibrantly engaged in the economy. And it is truly a community that crosses multiple generations.
I return to Michael. What about the cross section of veterans you serve at Brighton Marine? Who do you focus on?
Well, we focus on all veterans, Chris, of all demographics and age groups. But one of our missions over the last 4 or 5 years, we reshaped housing. We have a multi-income. We have, excuse me. We have a multi-income residence hall for 102 veterans that I think will help answer your question about the middle veteran. There's a 30% AMI income, and those are veterans that had struggled before, but now are finding some stability. They have a job, and then it goes up to a middle level veteran, a husband and wife, one serving, they have a couple of children. And then it goes to a veteran that's a little bit more well-heeled, maybe retired. And I think that our response was unique in that this veterans community, the first built, we understand, since World War II, that is not a long-term care facility. This is a living, breathing community, as Rosie indicated. And I think that needs to be stressed going forward with agencies like ourselves, that it's that connective tissue with the veteran space and in the large players in there, but it's also a great civilian connection as well. And that has to be accessed more, and really that narrative needs to be forwarded going forward.
Rosie, as your report noted, being a veteran is part of a success story for many people too. But on the other hand, because of the pandemic, that's being disrupted. How is that playing out?
I think you're seeing, veterans reflect the American population. And so you're seeing through the veteran population common trends such as the need for emergency assistance, the fact that you still have many communities and Americans, veterans are no different, that are faced with emergencies during COVID they need to respond to, housing and food insecurity, the need for access to mental health care and support services, obviously still on top of mind, especially for this community that frankly, the nation asks a lot of. I mean, obviously they wear, as we say, the nation's jacket, right? And represent us around the world. And now they come home and they're faced with this pandemic and economic recession. And so you have families who are being disrupted, both by losing employment. Most military spouses are seeking employment that have very high unemployment rates compared to the general population. You have military children who are now having their education disrupted themselves at home. And you have military members that are reacting to the fact that sometimes their ability to access the services that they need are either closed or negatively impacted, as is, quite frankly, the economy that they're trying to oftentimes transition into. So they are facing it in many ways from all fronts.
Michael, what do you see? I mean, people who are isolated, I know you try to give iPads to some veterans. Tell me about that and why they were so necessary.
I think we responded last spring to the high level of isolation that were in our long-term care facilities. We call them Soldiers Home in the Commonwealth, both Holyoke Soldiers Home and the Chelsea Soldiers Home. And actually working with Rosye and her contacts with Apple at a very high level, we had the opportunity to purchase at a discount some iPads that would, first of all, socially connect the veteran and the loved ones, because they weren't allowed in either facility, as well as regular civilian nursing homes during that COVID time. Secondly, we thought that it would promote a real robust telehealth function, so the veteran resident, the veteran patient could obviously continue their both behavioral health and clinical health by using this small device. And we think we've really got a lot of accolades relative to that. And then the VA got behind it. So a lot of companies kind of drew on our experience and has really made that technology accessible to veterans and their families, which is important.
Rosie, as far as access to healthcare, and especially at the VA, there were some positive things in this report, but there are also some shortcomings. Where were the shortcomings?
Well, listen, I think by and large, the VA is providing strong care and competitive care when you look at some of the satisfaction rates across the country. But the need for more robust telemedicine support, the need for appointments, timely benefits processing continue to be on top of mind for veterans across the country. And rapid appointment availability, right? There was a period of time that the pandemic disrupted not only the access to appointments, but for many, especially those outside of the healthcare system, those military transitioning from active duty deployments and active duty time, their transition support services were literally in chaos for a period of time. And so it took them a while to pivot to more virtual support. So you can imagine the disruption of somebody having to navigate this during the pandemic, while they're also having one of the most important times of their life when they're leaving the military and entering a new community, and everything in many ways is shut down. So the good news is you've had a tremendous amount of collaboration, not only by the government and the VA, but nonprofit organizations and at rallying around. And again, it is a community. I think that for one veteran that needs support, there are 3 and 4 that are navigating this successfully and are willing to support their fellow veterans. But we all as a community remain concerned and vigilant with regards to the access to care and services that veterans and their military counterparts are receiving.
Michael, as far as when you advocate for veterans and getting them help, I think at one time we might have thought it meant calling a congressman and getting more money from the federal government. But these days, you're working with this whole ecosystem. It's public, it's philanthropic. I mean, how do you make that come together?
That's a great question, Chris. Well, what we try to do is, we're a private charitable organization, so we have some flexibility on our philanthropy based on our high standards of quality care and access to services. But it's a good question. I think one of the outputs of the research study is to how Brighton Marine and other organizations, forward-leaning organizations, can really connect with the existing veterans community in Commonwealth. We have and it was mentioned in the report, we have a unique feature in which there's a veteran service agent or officer in every town or every borough of every town, which is split pay between the state and the town. And I think, as Rosye mentioned, navigation, if there's a veteran, for instance, just a metaphor, if no, they're not walking in to the town veteran services office, but they're connecting virtually like we are now, there has to be an extra piece of navigation that can get them not just a flag, not just a burial bonus or a welcome home bonus. We need upstream supports for mental health, clinical health, and that is really one of the goals that'll be coming out of this. And as Rosye indicated, it's already created a community amongst us. I've been talking to the CEO at home base at MGH about how we could integrate their terrific model of mental health services and how we can expand that out of their network to really every veteran in Massachusetts and beyond. So that's one of the goals.
Rosye, we all expect the military to involve being in a war zone and the post-traumatic stress that comes out of that. But, the military is also kind of a social battleground as well, where these conflicts over, race and sexual orientation. What needs to be done about that experience when it's amplified for people in the service?
I commend Lloyd Austin, the new Secretary of Defense, for tackling this issue the moment he stepped into the job. I mean, I think he understands that you have to put the issues on the table, address them. Women in the military are one of the fastest growing demographics within the military. We have to be willing to accept that their transition into the military and often the issues that they're facing are difficult and traumatic. And we, I think, as a community, are talking about it more openly, are being deliberative, are working together. Both philanthropy and government are working together to want to advance these issues. I think the report was very candid in saying that subpopulations of the veterans community have different priorities and different needs. And in many cases, we have not done a great job yet of understanding and prioritizing what those specific needs and priority services are. And so I was thrilled to see Secretary McDonough lean forward in his testimony and acknowledge the fact that there are specific needs for subpopulations of veterans and vow to address them, as has Secretary Austin. And I think philanthropy now will do its part. I mean, part of the reason we invested in this assessment, worked with CNAS on this report, was not just to inform our philanthropic investment, but to provide a service to our partners in Massachusetts and across the veteran community, and making sure that we are all talking about these issues, collaborating and learning from each other. We took this approach with a servant's heart, in the sense that we know there are other organizations that we want to partner with, that we can learn from. And it is about that unity of effort in supporting this population.
Rosie, I know that there are a whole lot of other things brought up in this report, from language barrier help that's needed, the application process being so complicated. So if people want to see more of this report, is there some way they can track that down?
We have it online on Brighton Marine. It is also public on the CNAS webpage as well. We are happy to please go to Brighton Marine and cnas.org to find out more about this information, and we are happy to continue to promote it across the country.
And Michael, people want some more information about Brighton Marine. Where can they find that?
Other than calling me, they can go to www.brightmarine.org, and you'll find the report there, and you'll learn about our missions on housing, on health, on hope, and really upward mobility.
I'd like to thank you both very much for taking the time to be with us.
Thank you, Chris, for having us. Appreciate it.
Michael Dwyer and Rosye Cloud from Brighton Marine.